Welcome back to our channel. Today we're exploring the CORAL trial to determine if renal artery stenting can improve outcomes for patients with hypertension or chronic kidney disease due to atherosclerotic renal artery stenosis. Let's dive in. The bottom line, renal artery stenting does not improve renal or cardiac clinical outcomes in patients with hypertension or chronic kidney disease due to atherosclerotic renal artery stenosis. Symptomatic renal artery stenosis, or RAS, can lead to severe hypertension, ischemic nephropathy, recurrent flash pulmonary edema, and refractory heart failure. While antihypertensive medications are the mainstay of therapy, renal artery stenting has become common in patients who don't respond to medical management. The Astral study in 2009 looked at the impact of stenting on renal function but found no difference between stented and non-stented groups. Astral was criticized for using a surrogate endpoint and including patients with potentially insignificant stenosis. The CORAL trial, published in 2014, addressed these issues by focusing on clinical outcomes. It randomized 967 patients with severe RAS to optimal medical therapy with or without stenting. The primary outcome was a combined measure of cardiovascular and renal events. After a median follow-up of 3.6 years, CORAL found no significant difference in the primary outcome between the stented and non-stented groups. Individual endpoints like stroke, myocardial infarction, heart failure hospitalization, and progressive renal insufficiency were also non-significant. The trial had several limitations. Both groups saw similar drops in systolic blood pressure, suggesting neither was fully optimized on antihypertensive therapy. Additionally, many patients were excluded by physicians due to the severity of their disease, potentially skewing results. The ACC-AHA guidelines, last updated in 2011, suggest percutaneous revascularization in certain cases of significant RAS. However, these guidelines do not reflect the outcomes of the CORAL trial. The CORAL trial was funded by the National Heart, Lung, and Blood Institute, with additional support from AstraZeneca, Pfizer, and Cordis. For more in-depth information, check out the references in the description below. In summary, the CORAL trial suggests that renal artery stenting does not offer additional benefits over medical therapy alone for patients with severe renal artery stenosis. Don't forget to like, subscribe, and hit the bell for more updates on the latest in medical research. Thanks for watching.